Alzheimer's disease now affects over 55 million people worldwide. That number is projected to triple by 2050. And yet the conversation around prevention remains almost entirely focused on early diagnosis, not on what can be done to stop it from developing in the first place. My guest today spent 26 years as a neurosurgeon before dedicating his career to understanding what medicine is missing. Dr. Russell Blaylock argues that Alzheimer's is not an inevitable consequence of aging, it's largely preventable circumstance. And that the nutrients capable of protecting the aging brain have been extensively researched, are widely available, and yet remain a largely untapped resource. Today, we're going to get specific. Early warning signs, the environmental factors driving the epidemic, and the 5 to 10 nutrients Dr. Blaylock would choose above all others to protect brain health into old age. And why, despite advancing medical science, the rate of Alzheimer's continues to climb. Welcome to Vital Signs. I'm Brendan Fallon. Dr. Blaylock, such a pleasure to have you join us on Vital Signs again.
Thank you. I appreciate it. Glad to be here.
Thank you. And with such an escalation, I mean, we're seeing Alzheimer's rate continue to climb, as I understand it. To start with, what are the major signs that someone, as they're entering their senior years, would look for to indicate that they may be at risk of developing Alzheimer's?
Yeah, one of the things we particularly need to emphasize is the difference between just aging and being a little forgetful and forgot where you park your car or where you put your keys or something like that. That's normal. But usually what happens is they become a period where they have disorientation. For instance, one person I knew would try to drive the kids to school, the grandkids to school, and get lost and forget how to come back home. And then it would pass. And so they have these episodes of this happening in the beginning, and then it clears up. And in the later course, it begins to be permanent. One of the early signs is a loss of smell or an alteration in smell. They just don't smell things like they used to. That's one of the early signs. And sometimes it's alterations of taste. But what we see is this is a very common early symptom. And that's because the olfactory system connects to the part of the brain that is first affected by Alzheimer's disease. There's various symptoms begin to get worse. So they're disoriented all the time. They're forgetful all the time. They can't remember names of family members. And so it becomes quite obvious at that point. And generally, Alzheimer's and these Parkinson's disease are clinical diagnoses. There's no test for them. So they don't generally have a test, even though you can scan and look for some of these amyloid plaques and tau proteins and things like that. So it's getting a little more sophisticated.
That's very interesting around the loss of the olfactory senses and the loss of taste. It's not something you'd generally expect. And that this is linked to the same system of the brain that's associated with memory. Quite fascinating. I'm interested to know, Dr. Blaylock, in part, would you say that Alzheimer's is a case of nutrient deficiency? And what would you point to as the most compelling evidence that that's the case?
Yeah, we looked at Alzheimer's brains and examined them to see were there any nutritional deficiencies. Things that stood out were the deficiency in thiamine. Vitamin B1 was very common, and it becomes quite severe in certain areas of the brain, the areas that are affected by Alzheimer's disease. And some of the early things, like in Parkinson's disease, the accumulation of iron in these areas that are affected in Parkinson's disease, for instance. We see the same thing in Alzheimer's disease. It begins to be an accumulation of iron and sometimes copper. What these metals do, they're very reactive metals, and they produce high generation of free radicals and destruction of brain cells. And so, it used to be they had geritol, and they told old people to take their geritol every day. And what they were
what is geritol? What is that?
Well, they had a very high iron content, and that was the idea was these elderly people are deficient in iron, but actually they had too much iron, particularly in Parkinson's disease. It's a very early finding. And it's what triggers the free radical generation that's causing destruction of these cells, and it stimulates glutamate accumulation, which produces excitotoxicity, another mechanism of all of these diseases. So we see
and that's destroying brain cells too, the excitotoxicity.
Right, and we find that excitotoxicity and free radical generation is characteristic of all these diseases. The difference in the disease depends on what part of the brain is most affected. And if we look at Parkinson's disease, about 30% will become demented eventually. And that's because it's affecting the microglia releasing glutamate, producing the same thing we see in Alzheimer's disease. So if you cure one, you cure the other, going in both directions.
Is that still a problem with the elevated iron in terms of these diseases, Alzheimer's, Parkinson's disease? And why is there such an issue of elevated iron for these people?
Well, what we see as you get older, both men and women, they accumulate iron in their brain. Women before menopause are getting rid of their iron by periodically bleeding, and that gets rid of the iron. It's kind of like a bleeding process we used to talk about. Men don't do that, and so they accumulate iron earlier. And once the women go into menopause, they accumulate iron in their brain faster. And so this accumulation of iron is connected to neurodegenerative diseases like Parkinson's, Alzheimer's, ALS, and all these rare things like multiple sclerosis. We see an iron accumulation. You have to have iron for normal function, but it has to be carefully regulated. If it's too high, it can produce degeneration of these nerve cells.
I imagine this will come up as we look at specific nutrients that you'd recommend, Dr. Blaylock, in terms of nutrients that would offset the elevated iron. Is that correct, or is that something we should talk a little bit about now?
Yeah, some of the nutrients particularly reduce iron levels, and others, while they don't reduce iron levels, they reduce the toxicity of the elevated iron. So that's the mechanisms that they're preventing these diseases is by controlling iron toxicity and copper toxicity as well.
Okay. Now, I know that you practiced, correct me if I'm wrong, but you practiced neurosurgery in North Carolina, Mississippi, and you had an academic appointment at the University of Mississippi Medical Center. You had significant experience as a neurosurgeon. In that experience, what did you learn there about the value of nutrients in protecting the brain?
Well, what I found in searching the literature at that time was that nutrients are very rapidly depleted, certain of them, like the B vitamins and vitamin C, within 24 hours can reach critical levels in the hospitalized patient, particularly the elderly patient. And a lot of the neurosurgeons didn't pay any attention to that. Well, I used to give all my patients an IV of these rapidly depleting nutrients like B vitamins and the minerals like magnesium. And I found that they did a lot better. And the nurses noticed the same thing and said, your patients are doing a lot better than the other patients. And it was strictly because you're paying attention to it. I remember one man that I operated on a cyst in his temporal lobe, and he was in terrible condition. And I could tell that he was an excess drinker. So I put him on rather high dose of vitamins, B vitamins, and particularly thiamine. And post-operatively, he said, I've never felt this good. He said, I really feel great. Well, he didn't know how depleted he was before surgery.
Because the alcohol was depleting his B vitamins, which are so essential for brain function, right?
Right, particularly vitamin B1, thiamine. And this is why we see the brain diseases with drinking. If people get demented if they drink too much and drink excessively, constantly, they deplete thiamine and riboflavin and some of the essential vitamins. And if you replace them, it stops the damage. And so that's something overlooked by a lot. And one of the things we know is that vitamin B1, for instance, is very strongly connected to intake of glucose. And these elderly patients will be admitted to a hospital, and they'll start a D5 in water, which is glucose in water. And their B1 is very rapidly depleted, and they can go into a coma and die. And it's just a simple matter of replacing their thiamine, and that prevents it.
Well, that's quite astounding that you were able to see these effects firsthand in patients suffering significant brain injury and similar circumstances. Would you say that nutrients that you prescribed at that time are also applicable in helping to prevent Alzheimer's disease? And which nutrients in particular would all serve both purposes?
If you look at Alzheimer's disease, for instance, they're all deficient in thiamine, and the deficiency is quite severe. And some of the early cases, if you replace the thiamine, you can prevent the brain degeneration. We see the same thing with Parkinson's and some of the other degenerative brain disorders, is if you replace this thiamine. And it was interesting, I found that when Parkinson's disease is early treated and seems to be getting better, their thiamine level goes up in their spinal fluid and in their brain. But unfortunately, the disease progresses too fast and eventually overwhelms the thiamine effect. But some people have found that if you replace thiamine, even in late Parkinson's disease, they can completely recover. We see that with some of the other neurological diseases also. If you replace thiamine in high doses, they can recover. And there's special ways to do that. There's certain supplements that can raise thiamine levels quite high. Normally, you don't absorb thiamine very well, and particularly if you're inflamed. If the body's inflamed, it's very poorly absorbed, and it's depleted from the nervous system and the body very quickly.
I think thiamine will be one of these nutrients that we'll get into shortly, of the ones that you'd particularly recommend, Dr. Blaylock. I look forward to doing that. Nowadays, many people are taking multivitamins, yet we still see a rise in the Alzheimer's rate. Is there something to do in the way that people are taking these things that are making them not as effective as they should be, or is it actually the quality of the different vitamins people are taking that isn't as good as it should be? Why may these things not be as effective as they should be?
Well, I looked into that, and I found out there's quite a number of supplements, particularly the B complex vitamins. It's very poorly constructed, very poorly absorbed, and it's a very low dose. And so they take this low dose and it's poorly absorbed, and they don't see a response. And so they give up early. And then we find that if you use the right form of these vitamins, particular thiamine, so that it goes directly into the blood rather than being absorbed through the stomach or intestine, and they use a sublingual form, that is under the tongue, the blood level goes up directly, and then they do tremendously better. And even if they use the intravenous, give them a shot of thiamine rather than trying to absorb a low dose, they do it far better and can recover from severe advanced Parkinson's disease. So it has a lot to do with that, the absorption. And some of the vitamins are poorly absorbed. For instance, if you mix it with coffee or tea or certain foods, you have to know when to take it, how long to take it, what dose to take. And there was a researcher who's a biochemist, a world expert on these vitamins, and he showed that as you get older, you have difficulty absorbing the vitamins and converting them to their useful form, and so they don't work. And so the answer to that is to take much higher doses. And we found that with thiamine, we found it with riboflavin 5-phosphate, and we found it with pyridoxal 5-phosphate. If you take a much higher dose, it's absorbed. So like thiamine and riboflavin have a special transport protein that transports it from the stomach into the bloodstream. Well, as you get older, that's very difficult and they don't absorb it well. So if they take a real high dose, it bypasses that need for the transport protein. They can absorb it directly, but it takes a significant higher dose. And unfortunately, most of the medical profession is not aware of this. And they don't understand the need for a higher dose.
Where would people get that kind of guidance on in taking something like in thiamine or riboflavin, how much they should be taking? Like what is a safe amount to take, and that it will be enough to actually have an effect?
Well, most of your B vitamins, except for pyridoxal, there's no toxic dose. For instance, we see a tremendous amount of vitamin B12 deficiency in the elderly. And we see thiamine deficiency, riboflavin deficiency. In England, for instance, 54% of young people, middle-aged people, were deficient in riboflavin. They think it's because of their absorption. And about 10 to 15% of the world has poor absorption of riboflavin. And so they're deficient, even though they're taking a daily multivitamin in a low dose, it's not absorbed. So it does them no good. They need to take a pure form of riboflavin, and the active form is called riboflavin 5-phosphate, which you can also purchase. And you take it in a higher dose, for instance, 50 milligrams or 100 milligrams, or you take it sublingually, then it starts working. Now, the exception to that is pyridoxalin, which is vitamin B6. And they found that above 50 milligrams, about 50 milligrams, it can damage the peripheral nerves in your arms and legs. But the pyridoxal 5-phosphate doesn't seem to do that. For generally, I recommend that people take no more than 25 milligrams of pyridoxal 5-phosphate once a week. And that usually takes care of their need for preventing Parkinson's and Alzheimer's and peripheral neuropathy. It's a very important vitamin. Most of the B vitamins play roles in hundreds of enzymes. In other words, they help the enzyme work. And the enzyme won't work correctly without these vitamins. And so the vitamins have a very important biochemical effect. Unfortunately, when you're in medical school, most medical students I knew, and it's kind of worldwide, they don't like the basic sciences. They don't understand biochemistry in many cases. They can't wait to forget it because they think it's unimportant. And it's like I told the head of biochemistry at the medical center, I said, it's extremely important. It's the biochemistry of disease. It's why we're having diseases. And he said, well, that's surprising. Most of my medical students think it's useless. So that's a big problem.
How, with the ones that we've just discussed, Dr. Blaylock, how would someone know that they're getting the right levels in their body? Should they have testing done? Would you recommend they have their vitamin B levels tested to determine if they're at the right level? Or are there signs that they should look for to tell them that they're at the right level?
You can get all of these tested, and they're very common. I mean, you don't even need a doctor's prescription to get them. You can just have them done. You can get thiamine tested and riboflavin, vitamin D. You can get most of these tested. And they'll tell you on the list what's normal, what's considered a physiologic level of these vitamins. And what we find is an important thing to understand is that vitamins like vitamin B, riboflavin 5-phosphate, plays a big role in the development of vitamin D3. And so you need D3 to make, riboflavin to make D3. And it also helps make pyridoxal 5-phosphate. So they interact and they have a lot to do with each other's level and absorption and function in the body. And most physicians know absolutely nothing about this. It's just a mysterious world they thought was a course you took in medical school to flunk out the weak students. They didn't understand that, no, this is the basis of all disease. In fact, I recently wrote an article called The Biochemistry of All Neurodegenerative Diseases, which is published and you can get free, which goes through this in detail of what these vitamins are actually doing. And the errors, like you say, is they're taking the wrong dose, it's poorly compounded, it's low quality, and they're not using it long enough. And so it goes through all of that in detail.
Okay. Well, we can put the link to that paper in the description. We've talked about the B vitamins and vitamin D3 a little bit. What other vitamins would you add to that that gamut of vitamins, Dr. Blaylock?
Yeah, there's vitamins, which most of us know about: vitamin C, B vitamin, D vitamin, and you should take them just as general health, general function. Some of the vitamins, like riboflavin and vitamin D3, prevent the cells in the brain, the microglia and the astrocytes, from secreting a toxic amino acid, glutamate. And so that plays a big role in controlling neurodegeneration, because most neurodegeneration is due to excitotoxicity. And then there's the flavonoids. The flavonoids are complex plant compounds. And what they do is they are much more powerful antioxidants. They inhibit cancer. They prevent inflammation. They do a great deal of things in preventing human disease, all kinds. For instance, quercetin, curcumin, which comes in turmeric, the spice. And bacopa is very important, which is another plant extract. And I found it really helps Alzheimer's cases. And
which one is that, Dr. Blaylock?
It's called bacopa.
Bacopa.
And you can buy that through Amazon or directly from the company if you want to make sure it's pure. But it's a very safe complex. And most of these things are safe. If you look at the safety studies that have been done by the pharmacologists, most of them are extremely safe, even in high doses for prolonged periods of time. Much so than the general physicians telling you that knows nothing about them. They say, oh, you shouldn't take it, it's not safe. And they know absolutely nothing about it. They don't know the safety studies have been done extensively. And most of them are extremely safe. Another one is nano EGCG, which is a extract, green tea and white tea. And it lowers overreaction of your immune system, like in autoimmune diseases, inflammatory diseases. The immune system is overreacting, and the EGCG reduces that. It also reduces an amino acid called glutamine level, and glutamine is a fuel for cancer. So we found that EGCG, by many mechanisms, also lowers the fuel for cancer growth. It's one of the few things it does. It's a very safe for the majority of people. And what I'm talking about in nano is people have absorption of some problems with some of these nutrients, like quercetin and curcumin and EGCG are poorly absorbed in their normal state. So we nanosize them. That means that you make them so small, the molecule, that you can absorb them. They're well absorbed through the GI tract, and they enter cells very easily, and they pass through barriers like the blood-brain barrier. So they pass through very easily. So they're much more functional. We particularly find this in cancer, like pancreatic cancer is very responsive to curcumin. The problem is people can't absorb curcumin very well. Well, the nanocurcumin works far better. It's almost like getting it intravenously. So most of these products, one company called One Planet Nutrition, they make the nano products out of these, and they're very safe. They're third-party tested, and he gets them only from countries that are considered safe sources. So it's very easy nowadays to get nano products to improve the absorption of them. And that has always been a big problem. Well, we know in a test tube they work extremely well, but people couldn't absorb them well. Well, with the nano products, they absorb them extremely well.
I know that some of these, like EGCG,
yeah, epigallocatechin gallate,
EGEC,
EGCG.
EGCG, and EGCG is found in green tea, white tea. Resveratrol is a component of red wine. Is it possible for people to get a sufficient amount of these, for instance, by drinking green tea?
Well, you don't really absorb them very well, and they come with other products we call catechins, which alone help some, but if combined in green tea and white tea, they can inhibit EGCG's function. And so you can get it as an isolated supplement in a nano form that's well absorbed, and you get the pure product of EGCG. And that turns out to be very important. The resveratrol is also extremely poorly absorbed. And we find that resveratrol does a lot of things for the body that's just like fasting. We know that fasting is extremely healthy. It makes the brain secrete a repair substance called brain-derived neurotrophic factor. And we know that it helps the various organs in their health and longevity, but resveratrol itself is very poorly absorbed. There's another form called pterostilbene, and pterostilbene is in grape, peanut butter, and a lot of different things, but it's not in high concentration. They have a concentrated pterostilbene, which releases very high doses of resveratrol into the blood. It's a very safe substance, and that way you can increase your resveratrol very easily by taking this pterostilbene. And you can get pterostilbene on Amazon, a lot of places you can buy it. It's over the counter. It's been tested for safety. It's very safe. In fact, when it first came out and they started testing, they thought it was a miracle. It does so many things to help the body. And resveratrol is considered a small molecule, and it does just amazing things in all of these diseases in protecting the cell, the brain cells, heart cells, all cells in the body.
What is there a particular research that you would point to, Dr. Blaylock, in terms of perhaps one of these or more than, or a few of these nutrients we've talked about having a potential to prevent Alzheimer's or neurodegeneration in general? Any main research that you'd point to for any of these things?
Most of them have been tested to see the effect on neurodegeneration. And they have almost miraculous effects in preventing neurodegeneration of all disease, Parkinson's, Alzheimer's, all of these diseases. The problem you have with Alzheimer's and Parkinson's is people are exposed to what's causing it constantly in very high concentration. For instance, we know pesticides, herbicides, and fungicides are the #1 cause of Alzheimer's disease and Parkinson's disease. Well, people play on golf courses. They spray them on crops. They're constantly exposed to these substances. And so they're continuously taking in these substances while they're trying to treat it. The analogy we always have is it's like having a boat with a hole in it. And you've got a bucket and you're trying to throw the water out of it to not sink. Well, you got to stop up the hole first. And that's what you have to do. You have to stop exposure to pesticides, herbicides, fungicides, and these other industrial chemicals. That's patching the hole. Then you bail it out with the supplement. And that's what the supplements are doing. But if you're fighting a losing battle, if you're constantly trying to stop the damage and you're still taking in the toxin. And that's why some people don't seem to have a response. And for instance, we know that Parkinson's disease is much more common in farmers, people around pesticides and herbicides all the time. It's much higher. And people don't realize that pesticides, herbicides from farming end up in the atmosphere. They end up everywhere in the world. They found them in the ice in the North and South Pole, even though there's no farms up there. So once the wind catches it, it goes all the way up in the atmosphere and goes all over the world. If you live next to a golf course, we find that the level of pesticides, herbicides in your blood is much higher than if you don't live, or if you don't play golf or golf. And if you're on a golf course, it's all over your shoes, it's on your golf clubs, it's on the golf bag. Take it home, put it in a closet, and now the house is filled with it. Wow. If you treat your yard with pesticides and herbicides to make it a beautiful green yard, well, it's usually do it in the summer. It vaporizes, and your ventilation brings it into the house. So you're exposed to it 24 hours a day. And some of these pesticides, herbicides are extremely powerful. In fact, one of them we use to produce Parkinson's disease in animals. It's one of the easiest ways to do it. It's used in lakes and streams to get rid of unwanted fish. And people don't know these things. They don't know that you're exposed constantly to it. One of the big causes of Alzheimer's and Parkinson's and other neurodegeneration, particularly ALS, is exposure to aluminum. Well, black tea has very high aluminum levels in it. Your drinking water has very high aluminum levels in it. And I know a researcher personally from England, Dr. Exley, and he studied this aluminum quite intensely and took Alzheimer's brains and compared them to non-Alzheimer's brains and found that the Alzheimer brain had extremely high aluminum level in the very area where the olfactory nerve goes into the temporal lobe, the first site of change in Alzheimer's disease. And so when you look at a normal brain, well, the aluminum level is not very high. If you look at Parkinson's disease, we see the same thing. The aluminum level is very high. If we look at Alzheimer's disease, the aluminum level is very high. And so what people don't know generally is that these people who talk about climate change, they secretly have been spraying nano-sized aluminum into the atmosphere for years. And some areas of the world, they've sprayed more. And I wrote an article warning that was going to cause an increase in Alzheimer's and Parkinson's. And then neurologists started saying, we're starting to see a high incidence of Alzheimer's and Parkinson's. Well, that's why, because you breathe out the aluminum through your nose, and it goes directly in part of the brain that we first see aluminum accumulation and pathological changes of Alzheimer's disease.
I'm interested to know, Dr. Blaylock, what you're describing, it sounds terrifying and pervasive. Like, even if you're not living near a golf course or near a farm, it's going to be somehow in your environment. I'm interested to know, what are you doing for yourself and for your family to keep the air cleaner, to reduce your exposure to these toxins in the air?
Well, the first thing, I don't live near a golf course.
And, sorry, say that again.
I don't live near a golf course, and I don't play golf. And the other thing is, in your house, you ought to have a filter, and it ought to be a high quality filter that filters the air and filter it all the time.
Like a HEPA filter?
Yeah, like a HEPA filter. And some of them have a carbon filter added to it. And so you get very clean air through it, and you run it all the time. Then the air in your house is much cleaner, but you still have a problem in the atmosphere when you go outside. If you're outside a lot, you're still exposed to it. Now, I don't know that's much you can do about it, but like the aluminum, we find, number one, don't drink city water. That water is contaminated with aluminum. They add aluminum to it. Filter your water. Wash your vegetables. Wash the pesticide and herbicide off the vegetables. And they all should be washed, even organic vegetables. And what they found is organic farms are maybe next to a regular farm, and it blows over onto the organic vegetable. And now they're contaminated. And so you wash all of them. And most of them are on the outside of the plant and can be removed easily with these special washers, which you can buy at a grocery store. And if you live near a golf course, well, I don't recommend people play golf. And they certainly shouldn't store their golf shoes and golf bags and golf clubs inside the house because you're contaminated. Garages are a source of a lot of this. They have things they use in the yard, like Roundup, to get rid of unwanted weeds and things. They're stored in the garage, and it ends up in the house. And people don't pay attention to it. These commercial companies will come and spray the yard during the summer to get rid of weeds. Where the kids and the animals are playing in the yard, they get it all over. And if you walk through the yard, even if they put little flags out, you walk through the yard, you have it on your shoes. Now it's in the house, and it stays in the house for 24 hours. So your only alternative is, well, I don't recommend people do it. Spray their grass and put these things on grass, but have a filter in your house. So you filter all of these chemicals out. Certain plants will remove formaldehyde and some of the other things that are outgassed from your house. A lot of new houses have products that they use to put down flooring and stuff that outgas formaldehyde. Well, formaldehyde is known as a carcinogenic agent and will very easily produce brain cancers. So a lot of these things you have to be aware of, that you're surrounded by environmental dangers that are increasing this. And we're seeing these things used increasingly. We're seeing this spraying in the atmosphere of these various chemicals. And one of their favorite is nanoaluminum. And people need to be aware of it. For instance, in Florida, the governor outlawed any spraying geoengineering of the atmosphere over Florida. And some countries have done it. You look out in the sky and you see these long strips and people think it's a contrail. Well, it's not, it's a chemtrail. It's full of chemicals. They tested it. They flew a small plane behind one of these jets and analyzed the chemicals. It was full of these things we're talking about. They're not contrails. They're not the normal contrails you see. Contrails are very small. These things stay there for hours and go from one end of the horizon to the other, and they form clouds. And they stay there for as long as 2 weeks, suspended in the air, slowly going to the ground. Then the aluminum ends up in your water, your drinking water, in the trees, in your plants, in your crops. And so it's slowly increasing the amount of aluminum that we get in it. So you need to take things that remove aluminum, like nanocurcumin, it removes aluminum. Quercetin removes aluminum. And so there's many of these things that we talk about that are supplements, particularly flavonoids, that remove these harmful chemicals and neutralize the fertilizer and different chemicals that are used or you're exposed to. And that's the secret.
Well, thank you for outlining this regimen, Dr. Blaylock, and identifying these toxicities that I certainly wasn't aware of, and I think the majority of people out there aren't aware of. Just in closing, if someone is starting to take some of the nutrients that you've suggested, what changes might they notice, and how long would it take for these changes to come about to tell them that what they're doing is having a positive effect?
Well, over time, they should see more energy. They have less achy joints and pains, muscle pain. They can think clearer. One of the things is the disappearance of what we call brain fog. A lot of people are complaining of brain fog, and they say, I just can't think anymore. And so what they do is take some of these supplements and clear these toxins out of their body and stop their exposure as much as they can. It tends to lift. Things like luteolin, we find out that it's very good at getting rid of brain fog. The thiamine, it gets rid of brain fog. And so slowly, if they keep taking them, they get better and better. Some of these things take months before you see a positive effect. And people think it's like a pharmaceutical drug where you take it and that afternoon you feel better. Well, supplements don't work that way. And what we find with the supplements is they are beneficial to many systems in the cell. A pharmaceutical drug just does one, and it has a lot of toxic effects. And so what we see a lot of people are taking so many pharmaceutical drugs that it's poisoning their body, and their systems are not working. So you have to wait to clear these systems from your body, these different chemicals, including prescription drugs, over-the-counter drugs. You need to clear them out of your system. And then the supplements will work a lot better. Then you see, well, now it's starting to work. I can think clearer. I can find my way back home. I remember the name of my grandchildren, their birthdays. And you start to see these effects. One of the fastest I've seen is with Bacopa. I had one of the Alzheimer's parents who happens to be a doctor, and I recommended it for their child. And I said, it's had an unbelievable effect on the child.
Which one is that?
Alzheimer's. It's Bacopa.
Bacopa.
Had a really rapid effect. And what they found with Bacopa is that even if you stop it for at least 3 or 4 weeks, it continues to work, and then it gradually disappears. So
what kind of effects did they see in that case?
Then they'll see a return to their brain fog, their weakness, and once they get back on the Bacopa, that starts clearing up. And so these effects are mainly slow to happen, and you have to use the right dose. And if you use the right dose of the right mixture, for instance, there's synergism in a lot of these things. And what we find with synergism, if you mix 2 substances, it's more than effect than just combining them. You get a magnification. Works even better. Instead of, I always say it's more than 1 + 1. It's 1 + 1 = 5, rather than 2. And so synergism is very important. We find a lot of these natural supplements are synergistic. If you combine them, they work even better.
It's been fantastic and very illuminating to speak to you about these nutrients and the toxicities that they're able to counter, Dr. Blaylock. Thank you very much for coming on the show, and I'll direct viewers to look for your the Blaylock Wellness Report, where I know you're putting out monthly, and you're looking at different toxicities people need to avoid, and also key nutrients that can help them to optimize their health, particularly their brain health. Thank you for coming on.
Well, thank you. I appreciate it. It's been a pleasure.
I would just